Jaundice is one of the common illness that a newborn can get. In most cases, it is not serious, while in others, it may require intensive medical care. In this video, we will discuss the jaundice in newborns, its symptoms and treatment. In jaundice, the baby's skin becomes pale and the eyes turn white and yellow. Jaundice occurs in babies after 3 or 4 days of birth, and sometimes it recovers on its own. But if the jaundice is not diagnosed on time and left untreated, it can cause serious health issues for the newborn. Why do babies have jaundice immediately after the birth? The old red cells in the body replace the new red cells, and in this process, the old red cells are broken. This leads to the production of the bilirubin substance, which is of yellow color in the newborn body. And when the amount of this bilirubin increases in the body, it is called jaundice. In pregnancy, the placenta keeps removing the bilirubin from the baby's body, but after birth, the baby's liver is not able to remove bilirubin, and it takes a few days for the baby's liver to be able to remove bilirubin. Usually after the birth, the jaundice is cured on its own by the time the baby is 15 days old. By this time, the baby's liver starts removing bilirubin on its own. If the baby is born premature or the baby is not able to breastfeed well, this can also be a cause for having jaundice in the baby. Lack of enzymes in the baby's body can also be a cause of jaundice, due to which red blood cells don't work properly in the body. Internal bleeding or blood leaking from the baby's veins at the time of delivery can also be a cause of jaundice after the baby is born. How jaundice is diagnosed in newborns? Doctors check the jaundice in the baby 24 hours after the baby is born. Firstly, the doctor physically examines the child's body to check the symptoms of jaundice. And if the doctor feels that the baby may have jaundice, then blood tests are done to check the bilirubin levels. So, how jaundice in newborns is treated? Normally, in most cases, jaundice cures on its own within 10 to 15 days of birth. But if the jaundice is not cured, then these treatments are done for the cure. First is phototherapy. In this, the baby is put on a diaper and the baby's eyes are covered. The rest of the skin is kept naked and the blue lights are applied on the baby. This way, bilirubin is converted into a form that is easy for the baby's liver to pass it through the body via urine. Another method is exchange blood transfusions. If jaundice is severe, the exchange blood transfusion method is used to treat jaundice in newborns. In this treatment, the baby's blood is removed and exchanged with the matching donor blood. Parents should keep in mind that babies who are discharged from the hospital within 24 hours after birth should take a follow-up visit to the hospital for a checkup after 2 or 3 days of birth. Breastfeed the baby, as the breastfeeding reduces the chances of jaundice in newborns. The breastfeeding also helps in treating jaundice. Let the newborn have the sunlight for a few minutes in the morning. When exposed to sunlight, the baby's eyes should be well covered by a cloth. If the baby has fever, or the baby is not taking feed, or the baby is sluggish, these are high-risk conditions. Consult your doctor without any delay.